Good afternoon, and thank you for joining AIDA and the Collaborating for Inclusion research team for our third webinar in the Leave Nobody Behind webinar series, Actions that Service Providers Can Take on Disability Inclusive Disaster Risk Reduction. My name is Margaret Morton. I'm the Executive Director at the Institute for Disaster Resilience, and once again, I'm delighted to be your host today. I would like to start by acknowledging that I am hosting this event today from the lands of the Ngunnawal people in Canberra, and I acknowledge the traditional owners of the various lands on which you all join us from today, the Aboriginal and Torres Strait Islander people also who are participating in today's event. I pay my respects to elders past and present, and I celebrate the diversity of Aboriginal peoples and their ongoing cultures and connections to the lands and the waters across Australia. Before we begin the seminar, just a few brief housekeeping notes. Some of you will be very familiar with this. Today's event, as many of you will be able to see already, is supported by Auslan interpretation and live captioning. Please check the chat window for the information regarding how to access these during today's webinar. The event is being recorded, and this recording will be made available after the event, including a written transcript. We'll be using the Q&A feature on Zoom to take questions. So if you have questions that you'd like answered during the seminar, just pop them in the Q&A box. Don't pop them in the chat. Please feel free to use the chat as you are doing right now to say hello and connect with others who are on the seminar. In the Q&A feature, you'll be able to upvote questions that you like by clicking the thumbs up button. And at the end of the seminar, I'll do my very best to answer a number of these with our speakers following their presentation. So again, I encourage you to use the chat to share any thoughts or reflections during the presentation. I would ask you to be respectful of each other and of our presenters if you post comments and reflections during the seminar today. So for now, this seminar is the last in the Leave Nobody Behind webinar series. It's been an excellent series with lots of interest from all of you and from others. So far, the series has showcased research that the Collaborating for Inclusion team has gathered while working with the government, with emergency services, with people with disability and their carers to co-develop initiatives that enable people with a disability equal opportunity before, during, and after a disaster. During these webinars, we have observed the strength of the partnership approach, using examples of growing collaborations across Australia between government, the emergency services, disabled people, and advocacy organisations. Today, we're going to explore what we're learning with community, health, and disability support services and share tools and resources that services can use to prepare themselves and enable preparedness with the people they support. Next, the research team will begin pulling the puzzle pieces together to develop a framework that will guide best practice, collaborative and multi-sector disability inclusive disaster risk reduction. Once complete, AIDA will again be very happy to support the Collaborating for Inclusion research team by launching the framework during our final webinar in the series. To talk more about the Leave Nobody Behind project and the topic of today's webinar, please join me in welcoming Associate Professor Michelle Villeneuve, Deputy Director of the Centre for Disability Research and Policy at the University of Sydney. Some information about Michelle will appear in the chat, but to save a little bit of time, we'll go straight to Michelle. So thanks, Michelle.
Thanks so much, Margaret, and welcome everyone, and thanks for joining us today for this third in the series focused on what service providers can do on disability inclusive disaster risk reduction. I have the pleasure of joining everyone today from the land of the Gadigal people of the Eora Nation, and I'd like to pay my respects to Aboriginal elders past, present, and emerging leaders as well. And thanks to all of you for joining us, because I can see by the interest and enthusiasm in this webinar series that we're responding to a need that people have to learn about inclusive disaster risk reduction and actually how to put it into action. So can I have the next slide, please? And if we're going to talk about DIDRR, it warrants unpacking this cumbersome acronym, Disability Inclusive Disaster Risk Reduction, or DIDRR. It really requires the actions of multiple stakeholders working together in partnership with people with disability so that we can identify and remove barriers that impact the safety and well-being of people with disability, not just during disasters, long before they strike, during disaster events and those early warnings that come with disaster events, during the response, and in the long term of recovery as well. So to foreshadow, I suppose, what's coming up with the framework that we're building, we've been able to distill through a lot of work over an 8-year period of time, 2 cross-sector collaborative approaches that actually activate disability inclusive disaster risk reduction. And those 2 approaches are person-centered emergency preparedness and disability inclusive emergency planning. We're going to focus a bit more on person-centered emergency preparedness, our education program, and some of the early implementation by service providers today to hopefully give you some tips and tricks to take away into your practices that you can implement straight away. Next slide, please. What you'll see on this next slide, just back one, please, thank you. What you'll see on this slide is quite a timeline with a lot of very tiny pictures. I want you, I suppose, to appreciate, first of all, that we're speaking to a project that has been ongoing in Australia since 2015 and will continue beyond 2023 as we have ongoing projects that will take us well into 2025. On this timeline, what you will see also is a number of tools and products that we've been producing and co-producing with service providers, with people with disability, with emergency services, and with government, all putting these tools into action as we go. So these products, all available on the Collaborating for Inclusion website, are all tools that you can use. But what we want to do today is talk through some of the key learnings and share with you some of the exciting developments in how to put these tools into action, but also how to do it more efficiently and more effectively, because time is always of the essence for community health and disability service providers. So we need to find ways to make that work really, really well for you. We've achieved a lot in an 8-year time period. And in fact, we brought to this Australian-based DIDRR research 2 years of work that we were doing in Indonesia, bringing those 3 sectors together to learn and work together about inclusive disaster risk reduction. And it was those formative learnings outside of Australia that led us to initiate the collaborative actions here on the ground, first starting in New South Wales and then expanding and scaling to other parts of Australia. The DIDRR program has actually progressed in 3 iterative stages. And at the bottom of the timeline, you can see those stages. The first was identifying the scope for our project. One of the things we did early on when we first started bringing stakeholders together in New South Wales was we created the local emergency management guidelines for DIDRR in New South Wales. In that process, we took the principles of DIDRR and we created actionable nuggets, things you can actually do at the local community level to take action on DIDRR. But at the time, we created one significant problem, and that was we recommended an action for which there were no tools anywhere in the world for emergency managers and government to take responsibility. And that was that people with disability need tools and resources so they can self-assess their level of preparedness, their capabilities and support needs. And they can translate that into an actionable plan that works for them and that is communicated with the people who will be there when disasters strike. So we set about this long journey, which is now where we're at today, sharing this with you, of building these tools and resources together and streamlining the person-centered emergency preparedness approach that I hope you all know really well. This is really the origin story of PCEP and the beginnings of its conceptual framing and its process steps. But if we think about these phases of identifying the scope and defining who does what and how and in what dosage, and how will that come together, it's really been an iterative cycle of development over time. We had some really interesting progress when we started working in Queensland to develop the DIDRR framework for Queensland. One of the instrumental learnings from that project was really defining for the first time what people with disability themselves can do and what the services that support them can take action on in disaster risk reduction. But a real turning point was when we partnered up with Queenslanders with Disability Network and their network of 25 peer leaders, which is now growing and expanding, not just in Queensland, but across Australia as we bring other disability organizations on board to develop and test these tools in their communities. What that did was really solidified the ownership, the leadership, and the central purpose of working in co-design with people with disability. And it really enriched our tools, including the PSEP workbook that I hope people know quite well, but also a number of videos, case stories, webinars, and videos that showcase how to put those tools into action. Now, as we've traversed along this timeline, we've been really aware that as a cross-sector collaborative act, DIDRR requires cross-sector mechanisms to put them into practice. And so all the work that we do really focuses on how do we bring individuals, the services that support them, together with emergency personnel and government to make sure this is actually going to work with just the right amount of overlap and redundancy to ensure that we leave nobody behind when disasters strike. We're making a sustainable impact. We not only have all of the tools you see dotted about that timeline, but we have the rule book for action and those requirements, which are now embedded in Australia's disability strategy, the National Disability Insurance Scheme, Quality and Safeguarding Commission legislative amendment, and accompanying practice standards. And interest is spreading. On the timeline, you can't really see the details of it, but later when we post this to the website and you go have a closer look at the timeline yourselves, you will see that we have been working in partnership with folks who are working in the aged care sector, people who work with culturally and linguistically diverse communities, in the housing and homelessness sector, including social housing. And we've been working more recently over the last couple of years in the United States, in Minnesota, with allied health professionals to build a family-centered emergency preparedness guide. And in addition, we're really excited that the work in Australia and the activities we've been involved in are making their way into the UNSCAP DIDRR e-learning module, which will be available across Asia and Pacific for all of our country partners and collaborators to get involved as well. Next slide, please. This is probably a more manageable way to think about our research, though. It's really about co-producing disability-inclusive disaster risk reduction practices that leave nobody behind. And it involves these 5 things. We build action-oriented frameworks and tools that people can use. We uncover the most effective and the most efficient delivery mechanisms where multiple stakeholders are concerned and where there's high complexity that requires us to have just the right amount of redundancy in the work that we do, but not so much that it's overwhelming for people to make a plan. The research and evaluation processes are instrumental to it, and in a moment I'll share a bit more about how we undergo that research process so that it's truly co-design with the 3 stakeholder groups that you see at the bottom. People with disability, and that includes informal carers who provide support on a routine basis, and those are the unpaid friends, family, and others who support people on an everyday basis, but it also includes representative organizations and advocates. In the center, which we want this webinar to be all about you, community, health, disability, and other services and supports who provide routine care and support in the community. And the local disaster management, which really encompasses our emergency service personnel as well as our government across the planning, response, and recovery phases of disaster risk reduction. We're working with all of these stakeholders to ensure that we build policy guidance, and we ask questions like who takes responsibility for the support needs of people with disability in emergencies, and how should that support be organized and delivered? And that's really the crux of the efforts that we've undergone over the last 8 years. And finally, because as we work our way across the development of what is a brand new practice and an emerging skill set for service providers, we recognize that by creating legislative change, we also create challenges for service providers. So we're really committed to a program of capacity development. And I'm thrilled that Parvathy be able to share a bit more about our person-centered emergency preparedness certificate program and our early evaluation findings, which are really exciting to learn. In this webinar series, we've been focusing on the roles of those different providers, and today we get to focus on you, service providers. Next slide, please. I really want to share that the work that we do goes through an appreciative inquiry action cycle. If you look at the center, there's what we call a co-production funnel. We engage in a process of inquiry, synthesis, and co-production, and that involves quite a number of approaches and methodologies, including inviting lived experience, information, and expertise into the process, but also looking at the peer-reviewed literature. So most of our work begins with detailed scoping and systematic reviews and synthesizing that information together with the lived experience in order to co-produce tools. But that doesn't happen in a funnel. It happens in interactive processes with communities. So I hope what people will understand and know about our research to date is that you will find us in the field working in partnership with people who are giving these tools a go as we co-design them together. And we ask questions like, what works really well now? And how can we embed new tools into what's already working for you? What could work well in the future, and how can we test them to adapt it for the most efficiency and effectiveness from the role and the activities that you engage in on a routine basis? So what you'll see on the next slide, thanks, Alyssa, is that we need a place to put all these resources, and we unapologetically share them as we develop the tools. And that's because we need your voice and we need your feedback and your input to make them really useful to you. There are multiple ways of delivering services to people in the community. There are multiple entry points and on-ramps to engaging in person-centered emergency preparedness. And there's incredible opportunities and richness, particularly in the disability, community, and health sectors, to connect people with disability to emergency services and information. So please visit our website and have a look at those resources there. Next slide, please. And I'll just end where I started, which was after 8 years of work, we've been able to distill into a more elegant design what are two key approaches to activating disability-inclusive disaster risk reduction. That is person-centered emergency preparedness and disability-inclusive emergency planning. The picture on the left, you will see the PSEP, or the capability wheel, that Parvathy will speak to about activating self-assessment and for ourselves and supporting others. And on the right-hand side of that slide, you will see community-level conversations, which have been a really exciting part of this work to date. I won't talk much about the DIEP today, but I'll encourage you to visit our website and learn more about our DIEP forums that we've been holding across 3 jurisdictions in Australia. And the last slide, I just want to let people know that this webinar series is leading up to a forum on the 2nd of June. We've been working at the grassroots of community, collecting information from the voice of multiple stakeholders. Now we want to take all of that information and share it with our peak bodies from the community health and disability sector, government, and emergency services. And we want to hold a final consultation about the working of our DIDRR framework and how it can be linked in really effectively into existing policies, so that it will be embedded where you live, work, and play as well. So we'll look forward to sharing that and showcasing that, as Margaret said, in another webinar later this year. And thank you very much, Margaret.
Thanks, Michelle. I'm in awe of this project, and every time you describe it or explain it to a new audience, I learn something new about the work. It's been such a fantastic project. So thank you for that introduction to it for anyone who's new to it all. I would now like to introduce you all to Parvathy Subramaniam. She's a research assistant with the Centre for Disability Research and Policy at the University of Sydney. She assists with the delivery of person-centered emergency preparedness. I think Michelle said that, through the Facilitator short course. It's a self-paced online course designed to equip learners with the necessary background knowledge and facilitation skills needed to implement PSEP. And I look forward to hearing what you're about to tell us all, because, as I say, I'm learning a great deal about this every time you guys describe it. So welcome, Parvathy.
Thank you, Margaret, and good afternoon, everyone. Thanks so much for joining us this afternoon. And thanks, Michelle, for such a great introduction to the big nature of the Leave Nobody Behind project, as well as all of the other research you've led, because it means that I get to focus solely about PSEP education. Before I kind of begin, I just want to acknowledge that I'm calling in from the unceded land of the Darug people in Western Sydney. So I want to pay my respects to their elders past, present and emerging, and extend that respect to any Aboriginal and Torres Strait Islander people present at our webinar today, as well as those who view our recording later on. On my next slide, we'll be able to see a little bit about what I'll be overviewing today. The first being why we need PSEP education. The second being an overview of our PSEP online certificate course, especially our evaluation findings, which are hot off the press. And then the third, which I think is the most exciting part, how you can take part in this exciting opportunity to not only learn more about PSEP, but also potentially take our online short course as well. So I'll dive straight into it. To answer that first question about why we need PSEP education, Michelle set the scene really nicely, but on my next slide, I've highlighted 3 really specific reasons that have really driven the process of the PSEP tool being developed. And I promise I'll explain in a lot more depth what the PSEP tool actually is. But also why PSEP education is needed. History tells us, and new legislative requirements tell us that there needs to be more done to enable inclusive disaster risk reduction in order for us to improve the resilience of our whole community, and that includes people with disabilities as well as other at-risk groups. We also know that service providers, so this includes people who provide direct support to people with disability. I'm talking about my counterparts, the community health and disability support providers in allied health, and as well as other roles, but also providers who work in emergency management roles where they are interacting with and working with people with disabilities, have strengths and are well positioned to enable inclusive emergency preparedness. But we get to this intersection, as Michelle said, where we can see these strengths and we can see how they can be leveraged, yet it's a new scope of practice and it hasn't yet been embedded within standard practice. So you can see on my next slide, this intersection that we get to where we can see the strengths, but we can also see the need for the right tools and the education to help service providers not only enable preparedness in others, but first and foremost, prepare themselves. In the center, I've put 2 key resources as part of our PSEP toolkit. And that's the reason I've done that is to show that PSEP is the bridge that helps to leverage these strengths, but then also fill this gap around training as well. So I'll go to my next slide and explain what exactly is this PSEP. Well, it stands for Person-Centered Emergency Preparedness, and it's a suite of resources. It's an approach that helps to match emergency planning to the supports that people need for their health and safety in emergencies. There are 3 key components to the PSEP. The first key component, which is on my next slide, is a capability wheel, and that's pictured right in the center of that screen there. The capability wheel consists of 8 different elements that were developed based on research into what everybody needs to do to prepare for emergencies. It includes the things that people with disability and chronic health conditions might need to consider additionally, but it makes it a tool that everybody can use regardless of disability or not. Those 8 elements, just to give you a bit of a teaser into that tool, are communication, management of health, assistive technology, transportation, living situation, personal support, social connectedness, assistance animals, companion animals, and pets. And as I've probably read or shared those 8 elements, I'm sure that they would have been ones that got your ears ringing a bit, because we recognize that some of these elements relate to everybody and some of them may not be relevant to you. But the idea is to get a holistic kind of overview to guide, as I mentioned, the self-assessment, how are you going in those areas at the moment in an everyday sense, but then tailor your emergency planning to those 8 areas. How you do that is on my next slide, which are the 3 underlying principles for the PSEP process. These 3 principles guide person-centered conversations, and then they ensure that the conversations are person-centered as well. The first key principle is acknowledging that emergency preparedness is a process and not a one-time event. How I like to see this one is that it's a series of conversations, or it's a series of interactions where you're building upon them over time, and you're revisiting them over time as well. The second being that people are the experts in their own lives, and planning starts with them. PSEP really helps, and following the process of PSEP really helps to put people in the driver's seat of their plans. A quote that we have from our evaluation findings that's really stuck with me from one of our learners is that people are the authors of their own plan. And when we're doing PSEP right, that's exactly what happens. And that's one of the underlying principles of the process. And then the third key principle is that person-centered planning conversations build capability of multiple stakeholders towards disability inclusive disaster risk reduction. And the in short version of that principle is that to do PSEP and to do PSEP right, we need multi-stakeholder collaboration. And these conversations on an individual level bring people together, which then propels us to make change on more than an individual level, on a community level, or an even bigger level than that. The final sort of component of the PSEP is the 4 steps, which is on my next slide. These are the 4 action steps that bring those multiple stakeholders together with people with disability or with your conversation partner, and guide that process. Those steps are step 1 being identifying your strengths and support needs in everyday life. This step is quite unique to the PSEP. Many other ways of planning for emergencies get you straight away to start thinking about what are your risks and what are you going to do about those risks. But PSEP allows you to start from a place of strength and evaluate how you're going in everyday life. It also allows you to assess how you're going in everyday life and make changes potentially that are required prior to an emergency happening. And we might hear a little bit more about that in our panel later on. But that's the first step. Because we've identified those strengths and everyday support needs, we can really leverage that information later on as well. In the next step, we learn more about our emergency preparedness. We assess how prepared we are in the present moment, as well as learn about what risks are posed to us. And then in step 3, we combine those 2 things to make a plan for how those support needs would be managed in an emergency. And finally, step 4 is looping it all back in with your support network and communicating that plan back through your support network, as well as addressing those gaps that you might have come across in planning through collaboration as well. So I'll go to my next slide now and kind of pause there, because that I can imagine that might have been a lot of information, and it kind of speaks to where the PSEP online certificate course came about. We had the PSEP and we knew and had tested that this is an effective and appropriate tool to use to have person-centered conversations to engage in inclusive disaster risk reduction. But when, as Michelle said, we put these tools out there and we got feedback from providers, from emergency personnel, from people that were using it, there needed to be more. There needed to be more around how do I facilitate these conversations and how do these conversations get started. So that's where the PSEP education stream of this research was born. And then now specifically, I'll speak to the PSEP online certificate course. So on the next slide, you'll see just a bit of an overview of how this course is structured and the format of that course. It came about after quite significant pilot testing with 76 learners from 4 different LGAs in New South Wales. We pilot tested it in different formats as well, in a face-to-face format, in a live online format, to really get the content right. And what we really learned through that process was 2 things. People loved coming together, and they loved meeting people that lived, worked and played near them in roles that are similar to them, but then also in roles that are complementary to them, that multi-stakeholder collaboration that I was sort of talking about earlier. So that was one thing. And the second thing was that by taking PSEP education, people learned about how prepared or unprepared they were, and taking this education actually encouraged them to become more prepared themselves. So those 2 key aspects, they're not the only things obviously that we took away from that pilot testing, but those 2 very key aspects really informed some of the tenets of how we have structured this online training. So the first being the importance of encouraging our learners to put their oxygen mask on first, and that is to improve their own preparedness first and learn about preparedness, and then also bringing people from multiple stakeholder groups together. So I'll flick over to my next slide, where you can hear and see a little bit more about who these learners actually are. So these numbers come from the EOIs that we've received between May last year to April this year. So we've had 688 people interested in taking this course from all around Australia, and the map shows you where exactly those EOIs have been concentrated from. Of those learners, and I should mention that enrollment into this course is ongoing, so we don't have only half of those who've been expressing interest enrolled into the course. They've accepted a place, I should say, in the course. 318 of those 688 have successfully accepted and taken part in the PSEP course. That's included 13 multi-stakeholder training groups that have been grouped by location. As I mentioned, that was an important piece of feedback that we took from our pilot testing. And of those 318, we've had a completion rate of 74%. So 236 people have, of those that have been enrolled, have successfully completed all 6 of the modules on how to facilitate PSEP, created their implementation plan, and finished the course as well, which is a completion rate that we're quite proud of. So I'll go to the next slide to give you a bit more of a breakdown around who those 236 people are. You can see on the slide there that we've had representation from the emergency sector and the service provider sector. I will say that the emergency sector also includes, not only includes, I should say, volunteers and staff of the emergency services. It also includes resilience and recovery workers, and council and community engagement, government emergency management staff as well. And then our allied health, housing and homeless, community and disability support providers are all included in that service providers category there. So again, prioritised having those mixed stakeholder groups take the course so that they can learn this information, and this information can be that common language between them, but then so that they can also learn with, from and about each other, and work together as they then go on to implement or take action around this space. So I'll go to my next slide now to share some of our early evaluation findings, our exciting evaluation findings, where we've used the Kirkpatrick model for evaluating the effectiveness of training programs to frame this evaluation. And you can see multiple time points where we do evaluate this course, one being before someone starts the course, where we're interested in getting their pre-course learning and behaviour, their knowledge before they've started the course, and a bit about their role and their background. And then immediately after their course, we're looking at their reaction, so their satisfaction, how much they valued the course, what were some of the key things they took away, and improving the course. And then 60 days after completing the course, just after completing the course as well, we retest that learning and behaviour. So we can then compare the pre and post. And then 60 days, we retest that learning and behaviour again, and ask more questions about implementation, which help us to understand the impact of this training, as well as understanding the barriers, the enablers, after people have had some time to then implement what they've learnt as well. All of these things are evaluated using self-administered online surveys as well. And all participants in the course are welcome to participate in this evaluation as well. So I'll go into my next slide now and share a little bit about each of those levels that we found now. So that first level being reaction. And as I mentioned, we really encourage and structure the course so that we're first equipping learners to make a plan for themselves and apply the content to themselves, and so that they can use their own lived experience then to then apply it to support others. And you can see on the screen there, our findings show that we're hitting the nail on the head there. People can use what they're learning to make a plan for themselves and then use that to support someone else to make a plan. And then on my next slide, we can see some of those early findings around confidence, around taking on this new role, which I've said is new and yet to be embedded as standard practice as well. And again, the likelihood of what they're going to be able to do with this content as well. If we go to the next slide, this next set of slides, you'll be able to see the pre-post comparison between learning and behaviour. So how did things change from before someone started the course to after they completed the course? I've put 3 specific sections of that evaluation where there was a significant change from pre-post. These findings are really important because, as I said, they show that what our learners have learnt helps them to make a plan for themselves. And it also then results in or improves their ability to have their own emergency plan as well. So that's there on the screen. And then I'll go to my next slide that just shows what that looks like on our own scale of emergency preparedness from pre to post as well. So that change in personal preparedness. And then I'll go to my next slide. This part now is quite interesting because this is about how confident and how much change there has been in relation to our learning objectives for the course. And those learning objectives relate more to enabling emergency preparedness in other people. And you can see there's been significant improvements in all of those learning objectives, which are based on those 4 steps. So I'll quickly whiz through these last 4 slides, where you can see the learning objective on the left, and then you can see some of the quotes that have come from our learners that illustrate that learning in action or that key takeaway. And I'll just repeat that there has been a significant improvement in relation to every single one of these learning objectives as well. Great. And I'll go to the next slide. So then this one is all about the step 2 learning objectives, connecting people in with emergency information, people and resources. Yeah, and we'll go to the next one, brainstorming together to make a plan. And then the final step in working as an advocate as well. Great, and as promised, I'll go onto my last little section, and I know I started this presentation with a 1, 2, 3, so I thought I'd finish with a 1, 2, 3, just around how you can take part in this course and learn more about it. The first thing you can do on the next slide is complete an expression of interest to take the course. Of that 688 that I mentioned before, all of those people have been offered a place in one of our previous cohorts. So there will still be more opportunities to participate, and don't feel like submitting an EOI now means you're at the bottom of that list. We really try hard to put everyone through in a timely manner. I'll go to my next slide quickly, and we'll share these links with you, but there's a whole PSEP resource package on the Collaborating for Inclusion website that you can visit and explore, and I encourage you to do so. And then the third thing is looking at some of our webinars and case studies and resources showcasing PSEP in action. But before you do that, don't sign off on this webinar, because we'll be doing just that really shortly in our panel as well. But for now, I'll hand back over to you, Margaret, to introduce our next section. Thank you.
Thank you so much, Parvathy. It's just so interesting, and it's very clear to all of us, I think, the value of this project and how important it is. There's nothing like, however, hearing from people who are right in the detail and applying the learning. So next, we have an opportunity to hear from a panel of practitioners about their actions and their progress on disability inclusive disaster risk reduction. And I'll introduce each panel member, and then there'll be a bit of a conversation. Now, don't forget that if you do have questions that emerge for you while you're listening, feel free to write them in the Q&A, and we will get some time at the end to ask some of those questions. So first, please join me in welcoming Emma Birch. So Emma is the Regional Manager for Rocky Bay Health and Community Services in Western Australia. Welcome, Emma. We'll just go through the whole list of everybody. Let's welcome John Fennick. John is a Bushfire Recovery Manager and Community Development Officer with St Vincent de Paul. Heidi Chapello is the co-founder of PSEP Connect Hunter and an Emergency Management Project Officer in New South Wales Local Land Services. Welcome, Heidi. I would like to acknowledge that Raylene Bock is, we hope, listening in. Raylene, I hope you have a chance to listen in and or listen to the recording later. Raylene's an apology, and I know she'll be disappointed she's not joining us today. But Amy Parker is the final introduction, a connected coordinator, I'd love to know what one of those is, for the Singleton Neighbourhood Centre, the Singleton Neighbourhood Centre. So I'll now hand back to Parvathy, and Parvathy's going to somehow magically facilitate all of you in having a conversation together.
Thank you, Margaret, and thank you to all of our panelists who have given up their time to join us today. It feels a little bit like a PSEP education reunion today, so I'm really excited to facilitate this section of our webinar today. What might be helpful as a way of getting us started is a question about how you all got started in your PSEP journeys. I might pass first to John, because you've been involved ever since the pilot testing I spoke about in my section, around how you got involved with PSEP and some of the actions that you've been taking to bring PSEP to your organisation or to your community.
Yeah, hi everyone, greetings. Hi Parvathy again, good to see you. I should just acknowledge that I'm on Gadigal land here as well, and I'd like to honour elders past, present and emerging. How we got involved? Yeah, so I manage a bushfire recovery and community development program for St Vincent de Paul, New South Wales. And as we got started in that, so we set up our program. One of the areas is disaster preparedness for future events. So we were doing a bunch of research, and we were speaking to people in affected communities, and we heard a lot of stories of individuals who sort of got a knock on the door from emergency services, told that they had very little time to get out, and then the emergency services themselves had to go and do more knocking or go and help in another situation, and they were sort of left to their own devices. And a lot of, we heard that story repeatedly. As we were doing the research into getting the program going. And so we sort of came up with our own little harebrained scheme on how we could identify individuals who are probably in a bit more of a vulnerable category, get their information sort of documented and centralised somehow, and hopefully it goes to the council and they manage it. And there would be a sort of direct link to emergency services in the future event. So we were sort of thinking along those lines, and then we came across PCEP through some sort of recommendation, I can't quite remember. And we sort of jumped at that immediately because it just spoke to us and it sounded a lot more thought through and robust than our sort of little harebrained scheme that we had come up with. So we really jumped at the idea, and then we put our hand up, or we sort of actually forced an opportunity with the pilot. I think it was already booked by that point, booked out the pilot, but we expressed a strong desire to participate, and the team at Sydney University were very gracious in allowing us to come in at the 11th hour. So that's sort of how we got involved. And also I sort of, my program is in a section of St Vincent de Paul, which is the Disability and Inclusion Division of the organisation, of the service provision program delivery, part of Vinnie's. And so it's very much to the core of what we do.
Awesome, thanks, John. And that's how you got involved, but I know that you've taken many more actions since that initial pilot training. Do you want to share a little bit about the work you've been doing on the ground?
Yeah. So once we sort of got skilled up in the pilot, in the model, through the pilot, I should say, we were sort of lucky because we were doing that stuff I mentioned earlier about sort of trying to identify some people in our communities we were working in who were already quite vulnerable and who had been affected by that vulnerability in the bushfires. We sort of had a small list of potential people to have a conversation with anyway. So we were quite lucky in that sense. And so we just sort of launched straight into it. Having said that, we identified a couple of people who would be sort of full-time or semi-full-time on PCEP too. So that was their roles, was to follow up on those leads and those existing relationships we had with people who we thought might be interested in the PCEP. So yeah, we started doing that and really just sort of knocking on doors and starting conversations with people. And yeah, got a bit of traction. And we were lucky enough to sort of get a sort of 10 or 12 people sort of going through the process quite early on. And our program is an interesting one because it's fully sort of funded by public donations. So we have a fair bit of flexibility with the way that we use that. And we were able to put a bit of money aside to be able to help sort of fund some of the resources, solutions that sort of are suggested and come up through the conversation process that are suggested by people themselves. As we talked about, they're the authors of their own future preparedness. And so that's one of the other things we did, aside from having sort of people working on it full time. We had a bit of money behind it as well to fund some of the things that come out of the planning process conversations.
Awesome. Thanks so much, John. I might pass over to Emma now to share a little bit about your PCEP journey. Yeah, I'll go to you, Emma.
Great, thank you. So I'm a speech pathologist by trade, and I work for a disability organisation in Western Australia, and I've seen that there are other people on the chat from Perth as well, so I'll be so keen to connect with those people. I think we came... Yes, I'm with Rocky Bay. I'm part of the therapy division, but we have supported accommodation. We also have support workers doing community access. But I came on board really because I'm really passionate around communication access. So making sure people with a communication disability can communicate in times of emergency. And I worked with the Department of Fire and Emergency Services in WA to help some of our customers and DFIS when in an emergency, having those customers calling for help. So it was around, we specialise in customers prescribing alternative communication systems, so giving them programming into their communication devices, conversations and vocabulary around emergencies. So that's kind of where I got started. But then being part of PCEP, that's just the start of calling for help, is the first part of emergency, or it's not even the first. Preparing should come before that. So I guess that was the good thing about PCEP, was learning how much more we could do to prepare people in an emergency. So yeah, we've helped people with us. We started with clinical because it was where we were, but we've also started to help people in our supported accommodation homes as well. understand the vocabulary, what an alarm sounds like, use the capability wheel because it's got some excellent visual support as well. Coming from a speech pathologist as well, I'm very communication based, so PSEP really helped us learn how to consider every part of a person and how to help them plan in an emergency. I mean, we did worry that we would be, by starting these conversations with people with communication and some cognitive difficulties, that we might increase some anxiety, but it's been actually the opposite. It's been so good. People have been so on board talking around how they can prepare. So it's been really eye-opening.
Thanks so much, Emma. And I think your story and John's is not unlike many people potentially on the call today who are thinking about jumping in and taking PSEP training and bringing PSEP to their organisations. I think we all start with this idea of what implementation could look like. So firstly, it's just helpful to hear all the varieties of ways that it can look like. You'll notice that in talking about the education, we had streamlined the education process, but in no way we've streamlined what you then go out and bring to your communities. Another piece that you spoke to, Emma, is this capability wheel, which is a core component of the PSEP. And it's a crowd winner, I think. Everyone talks really fondly about the capability wheel as a way to start the conversation, as a way that people can relate and start from a place of strength, as you've mentioned, even if they've not engaged in the process as well. So Heidi, I might hand over to you to talk a little bit about your PSEP journey, but I also know that you speak very fondly of the capability wheel as well. So I might invite you to share a bit about that too.
Sure, thanks, Parvati. So I'm here today in my role as Hunter Local Land Services, but my PSEP journey started a while ago. I met Michelle in 2019 and got through the Collaborating for Inclusion resources back then. So I've been eagerly sort of following its development, including the capability wheel. I think we brought it to a community planning event in 2019 at the Central Coast. So in 2021, I was having conversations with Raylene Bock, who's a person with lived experience of disability. And we were sort of strategizing about getting PSEP started and a disability inclusive emergency planning day started in Singleton, LGA. That was a little bit slow. And so 12 months ago, Raylene said to me, look, we've been talking about this for a while, but I still don't have my own plan. Can we start a group that's focused on me getting my plan? And so that's how PSEP Connects Hunter started. And it was also at the same period of time that the PSEP short course was getting going. So Raylene and I both enrolled in the short course. And it became clear that we needed like a landing place for people who were interested in PSEP or had just finished the short course, and a little community to practice what we were doing and to perhaps, if we were lucky, seed some more momentum for something bigger to happen in the Hunter region in a future iteration. So I got through the short course and the group started. We started getting, Red Cross and SES and people from different councils popping along. It's really minimalistic because it's not really central to my role. So I said, Raylene, let's just do 1 hour every 6 weeks. And that's really the baseline. And that's what we've stuck with. So it's something that we don't need funding specially for, and it's just something that we can roll forwards with, and it's not too invasive in anybody's life, hopefully.
And then I think that's how someone like Amy, who hasn't yet taken the course, then gets to be involved and the word gets to spread. So I might pass over to Amy now to share a little bit as well.
Yeah. Hi. I'm employed by the Neighbourhood Centre at Singleton. So my role itself as community connector, like Margaret pointed out, was initiated as part of a bigger community development process towards this elusive concept of resilience that we're all chasing. So the purpose of my role was to hold a space where we can develop strong community connections and resources to sustain collective, peer-led and community-driven change. So I guess through those networks, I came into contact with Heidi and Raylene. Raylene has quite a long-standing relationship with the Neighbourhood Centre that's been built over many years before my time. That's been built with a number of, I guess, positive interactions and positive outcomes over the years. So it was a place for her where she was, I guess, comfortable to come to and approach us for assistance in progressing some of her ideas around PCEP and where she wanted it to go at a more localised level for our LGA.
Awesome, thanks Amy. And I think that illustrates that process of PCEP starting that one-to-one conversation and getting an individual plan in motion, but then kick-starting that process of disability inclusive disaster risk reduction on a wider scale as well, and on a community level too. I might then invite you all to have a bit more of a think and share around this journey, which I imagine as you started, you were expecting it to go one way. And then as you've gone on the journey, you've learnt more things and changed perhaps the way you've gone about things. I know that, John, you had mentioned thinking creatively and using funding in a different way. And then perhaps what you expected the project to entail. I wonder if you could share a little bit more about what that's looked like for you and why being flexible has been an important part of your PCEP implementation.
Yeah, I think on the back of that early momentum we had, Parvati, I thought we probably had an impression that it was going to really, really take off. And I think everyone here is probably understanding why we might think that, because we're all got an interest in this and feel there's some real value to it. It didn't, sadly. I'm not saying it hasn't been successful, we probably define it as, but considering we had that sort of early group of people and there was a lot of interest early and we were having a lot of conversations, we did really think that was a strong platform for it to grow really quickly and probably organically in the areas that we were working. It sort of hit a bit of a speed bump though, and we sort of struggled a little bit after that, because that was sort of our own generated network that we started those initial conversations with. And then after that, we were really reliant on council and service providers, I think, to start creating a few more connections for us, where we were sort of struggling to get our own connections. And that didn't really happen for a variety of reasons. So yeah, we have had to be creative in that sense, and we've tried to figure out different ways to connect with potential new individuals to have the conversations with. I wouldn't say we've nailed that at all, Vaki. We're still sort of probably more in that the slower phase of having the conversations than we were initially, and I'd say that's a little bit disappointing for us. But in terms of the creativity, I think it comes out of the conversations themselves. I mean, I don't say that Vinnie's is creative or the way that we're running the conversations is creative or we're creative in any way. I think it comes, again, going back to that point about people being the experts in their own lives and the authors of their own journey. The creativity is there. They're the ones that come up with the solutions. It's when someone like me comes along and describes it to an audience that sounds creative, but it's not me. No, I'm sort of, unfortunately, I get to take credit for it in an unjust way. So, but look, going back to that initial thing about the funding, like, as crass as it sounds, we all know that money does help. We've been quite lucky that we do have these flexible pot of funds that our staff can dip into, and they dip into it for really practical things that are, again, solutions and suggestions are being suggested by the people themselves. So just a quick little example of what that might look like. And we had one person who she has a form of epilepsy, and she's quite a severe form of epilepsy. So she's always been very anxious about having a seizure in a public space where, because she lives rurally, I should say, on a big plot of land, and she's been very afraid and anxious about having a seizure when she's sort of too far away from her home or her support network, and then no one would find her. And so what we did through that conversation, we were already working with these things called personal locator beacons, which are just little devices that you can quickly push them, and it sends off an emergency signal to a central area in Canberra, and it gets relayed back to local emergency services. So a small little investment of a few $100s in that has it's given her a whole new form of confidence. So much so that she's expressed that to us as well, written, saying, I just feel so much freer than I was now, and I can go places because I've got this there and I know it's a bit of a backup. So things like that, that's the creativity. It's not us, it's the individuals.
Well, I would disagree in one sense around bringing these conversations to life in the community, give rise for these stories and give rise for these things to then happen. And I can see that Heidi is nodding her head as well. Just again, I imagine with the Hunter PCEP Connect group, we've also heard similar things around, you know, bringing, starting the conversation and bringing it quite physically to your community. I wonder, as we're kind of coming close to the end of our time, and I could listen to you all speak all day, I might invite you one by one to share a little bit with our audience today around getting started, and one piece of advice or one action that you've learned that's important as a tip to get started on this journey as well. I might go backwards this time, and I might start with you, Heidi.
Sure, Parvati. So a couple of key important points that we really try to centralise in Hunter PCEP Connect is allowing time for people with disabilities to stay at the centre. People with disabilities don't want to be left behind, especially this is leaving nobody behind project. So I encourage you know, people to ask, how can we partner with people with disabilities and develop opportunities for them to lead in this space. The other thing that I was thinking is pretty important is we're having our group as a mixed abilities group. So everybody is putting on their own oxygen mask first, to use your turn of phrase, Parvati. And that makes us sort of connect and build community human to human, that we're doing this shared activity. And that means that we're also learning how to have inclusive conversations. What does it mean to be having a Zoom call, you know, when we need somebody with vision impairment in the room, or somebody with intellectual disabilities in the room, somebody from the SES, for example. So that's a really important part of how we work. And there's one last thing, is just that we really want to generalise the use of the capability wheel. It's a great tool for risk assessments, for problem solving, for intake of staff and intake of clients. And yeah, everybody needs to put on their own oxygen mask, and that capability wheel is a great tool to generalise. Thank you.
Awesome. I can see, Emma, you're nodding your head. I might let you jump in there to share your tip and takeaway.
Sure. Yeah, I'm agreeing with everything that people are saying. Oxygen masks on first, and exactly, someone had mentioned it earlier, it is really a series of conversations over time. You're not going to bang it out in one session, and you're not going to have all the answers and the ideas at that one time. So it is a process that you think about and come back to. And I guess from us, it's been quite hard to start that movement as well. So I guess I feel heartened, John, that you've had that same journey as well in the eastern states and starting it in WA. It's hard to, when you're not quite sure what local governments can do and what emergency evacuation centres there are and what they could offer, getting that for the whole of the Perth area, it's been tricky. So we're just focusing on one patch, just getting our own little house in order, the own oxygen mask, just working on that and building that network, and then gradually getting bigger. The one bite of the elephant at a time analogy, because it is, yeah, it's big, and But the more people who you have conversations and come on board, the more of a movement you can see starting. Yeah.
Awesome, thanks, Emma. You reminded me of one of our first PSEP facilitators who introduced me to the phrase, sometimes you need to go slow to go fast. And I think that
Yeah.
to this process, because you're definitely making headway and you're building momentum and you're building traction, and sometimes it doesn't feel like it perhaps, but that persistence does pay off, and that persistence seems to be a key component to all of your stories and stories of implementation too. Amy, I might invite you to share any remarks that you have to close us out for today.
Yeah, sure. Look, again, it's very similar. I think it's allowing time for things to be able to grow organically, and for organisations to be realistic about outcomes, because they're not always tangible. So that can be difficult as well. So it's about those expectations of the organisations, but also to look at how local organisations can work with the local community, not just when disaster hits, but as people have said, long before that, to establish those relationships and to hold space for that collective action to happen. So Raylene is part of a local peer-led can-do community that we host here through the neighbourhood centre, and we are able to auspice grant applications to be able to assist with implementing PSEP into our local area. Whereas as a peer-led group, she wouldn't have that capacity to do it on her own. So the organisations really need to come to the party here, I guess, and to open up and allow some space for that peer-led collective action to happen.
Thanks, Amy. I know we have more time for a Q&A, so if there are other questions that you'd like some of our panellists to answer, feel free to put those in that Q&A. But Margaret, I might hand back over to you for now.
Such a fabulous conversation. I'm finding that the webinars where we do this kind of thing are so rewarding, and I know that because of the chats and so on, we feel like we're eavesdropping on a conversation between you all. Look, I will go to the Q&A now, and so I'm going to suggest that all of the speakers, Michelle, you might like to come on as well, if we perhaps put all of the speakers back on screen. And then I'll ask some of the questions that are in the Q&A. If you haven't had a look at the Q&A yet and you're participating, please do have a read. If you particularly like some questions, by all means, vote them up. And I've thought of some additional questions myself. So we're going to do this in a really unruly manner, I imagine. So if I ask a question and you think you'd like to give it a shot, just by all means unmute, and we'll use that as a bit of a signal for who would like to speak first. So hello, Angela Draper, your question has made it to the top. So Angela's got a question about how this kind of PSEP planning process compares or fits alongside other ones like the Ready Plan. And I have to say, as I was watching all of today's session, I was thinking, you know, I actually could probably have a look at this myself and use it as a way of engaging with my own personal safety and resilience, and then work out how to help neighbours and friends. So how does anyone want to give a shot to how it fits or aligns with other planning tools? Michelle, go for it.
Yeah, I'm happy to speak to that one. I guess, first of all, I should say that across all of our projects, but nationally and in each jurisdiction that we work in, Red Cross is a partner. So they've been informing through their wealth of expertise, not just in the development of the Ready Plan, but in all of the recovery work that they do, and in particular in elements of psychological first aid. So I guess the first thing to recognize is that brilliance coming from the Red Cross has been built into the PSEP from the outset. The other thing I think that's really important to recognize is that it's very easy for us to say, oh, well, we all have to prepare, so we can all use any tool to prepare. True. And I would recommend anyone take any tool and start preparing. Whatever resonates for you, use it and make a plan. But let's not forget that people with disability have extra support needs that require very specific and unique tailoring to their support needs and situation. And I think we have still a very long way to go to make sure that the person-centered emergency preparedness tool is in their hands. And I would really call to action our service providers who have routine interaction with the people that you support, people who are housebound, bedridden, people with multiple chronic conditions, people with significant mobility and communication issues, people with multiple chronic conditions, and so on, are the people that we really would call upon you to support reaching out and starting that conversation. It can be really hard to start a conversation. I remember when we were co-designing this tool and we were going out in the community with some public health nurses to have these conversations with people in palliative care. Stop and think about that for a minute. A little bit hard for these nurses to think about initiating that conversation. However, it was so powerful because the capability wheel put the conversation and the control in the hands of, in this case, this particular individual and his wife. What was so beautiful about that conversation was they found incredible meaning, because in this particular case, the wife was planning a visit where she was going to be away from home for an over 2-week period of time, visiting family in another country, and she was leaving her husband behind for a 2-week period. The person-centered emergency preparedness process was actually used to help them make a plan for how they were going to manage both emotionally but also practically while she was away during that period of time. And of course, her biggest concern was that he may pass away while she's gone. So it was really incredible and so powerful for those palliative care nurses to turn that conversation into something that they actually were really good at, doing palliative care, making those plans with the people they support.
It's so interesting. I'm sure it's not true in all cases, but sometimes what feels like it's going to be a really difficult conversation is welcomed with open arms. I know the same thing happens with children and young people. Parents and others don't want to frighten them, and so they put off conversation. And then actually, it's so much easier when we have the conversation. So if we can find ways to do that empathetically, it's amazing how often it's welcomed, not a fearful thing. So the second question on our list is, this is so interesting because it's a question about systemic and structural injustice and inequity. So I'm hoping the answer to this question is yes. Does PSEP also help people in understanding how they can remove, I'm assuming, other structural barriers to safety, justice, equity, supporting people being resilient in a structurally inequitable and unjust society? You know, has anyone got any thoughts they'd like to share about the consequences of doing that work, or the consequences for other elements of inequity and injustice? There must be a radical amongst you.
I'm going to start, but then I'm also going to invite John to share, because when I read this question, I thought of a specific person that his team worked with in Kempsey that has also then influenced some of the way we teach PSEP now, which is all around that step one component around starting with the everyday. And this notion of how can we expect someone to be managing in an emergency when they're not managing very well in the everyday. And it has really given rise to a shift in our thinking, specifically around these structural barriers and inequity, and how we need to first address and make those shifts in a day-to-day sense, to then also bolster our emergency preparedness and response. But John, I wonder if you want to share a little bit around some of the work your team has been doing in that sense as well.
Yeah, I think there's probably a few examples that fit this question. I'm not sure how long we've got. I could probably speak all day about it, but just one that comes to mind is, one of the people that we're having PSEP conversations with, sort of a fair way into the process, revealed that they are illiterate. And that's a sort of obvious structural barrier that I think most sort of service providers, especially a lot of government ones, would just assume, they would take for granted that someone could be able, would be literate. So it definitely does highlight a few of those. I mean, we've brought PSEP to local land council up in the Kempsey area as well. Had a couple of conversations there. Again, sort of it's sort of starting to highlight some very obvious structural injustices that exist with that particular group of people. And from that, I think it allows us, like the conversation, I can't say that the work that we've done has allowed us to change the world or radically change local structures in any meaningful way. But what it has done is it gives us a fair bit of information, gives us a more acute understanding of those barriers for these particular people, the people we're having conversations with. And we have used that for ongoing advocacy and lobbying locally to try and get the local authorities and duty bearers to understand what it's like in those shoes.
I agree. Well done. The next question is really interesting, and I'm going to seize the moment to say this kind of question will also be explored in our seminar later this week with Daniel Aldrich, for anyone who's interested in it. But this is a question about how do we demonstrate the financial cost and benefit of this kind of personal resilience. And as Sean has said in the question, the world really, not just most organisations, many organisations, lots of the world in which we live and work has a very tight focus on measured cost benefit analysis. And resilience can be difficult to put into that frame. So Sean's question is, do you have any suggestions as a panel about how to prove this financial benefit for preparing and helping social community individuals prepare more effectively and enhance their resilience? Any thoughts from anyone? I would say, Sean, come on Wednesday when we talk to Daniel and ask that question again. He's the expert.
I'm happy to add a few thoughts, because I would say that our team, which includes my postdoctoral fellow, Dr. Jade Chang, who is a health economist, and so she is just itching to explore the possibilities of these questions. One thing we are doing in the very short term is in our national surveys, we've asked people about how much they value being supported to make a plan. For some people with disability, the rate limiting factor can be getting started. We heard at a Disability Inclusive Emergency Planning Forum in Bellingen very recently from a very active counsellor, actually with counsel, who also lives with disability and has a child with disability, just about how it can be so hard to get to that next task and how valuable it would be to have someone to support that conversation. So we're asking that question in our surveys, and stay tuned for the answer to that question, because we are learning that people do value the support to prepare, and it is important to people. That's only one part, obviously, of the question. We're working on our program of research around the issue of data and evidence, which is sorely lacking in this area. So it's really difficult to prove that preparedness works if we don't measure how prepared we are. Through our national surveys, we've been painting a picture of how prepared the general population is in comparison to informal and unpaid carers, and in comparison to people with lived experience of disability. Stay tuned for those survey findings so we can start to look at and paint a picture of the level of preparedness, the capabilities and support needs. But we've also been doing that with service providers and organizations to look at how prepared our services that provide that support are, and how ready our organizations are to provide service continuity and support. All of these things are part of that big picture puzzle. And I think what we need to be doing in a really deliberate and systematic way moving forward is gathering the evidence to show the preparedness and to show, how aware, capable, and prepared people are, and the evidence in their plans. The reality is, I'm sorry to say, we probably will have the opportunity to look at subgroup analyses following disaster events. It is in the following the disaster events, once we have a critical capacity of people with person-centered emergency plans, organizational and service continuity plans in place, which the new legislative requirements under the NDIS is going to help, hopefully, get lots of those plans coming up. Once those are in place, we can do analyses to look at the impact after disaster events and look at those costs.
Could I just add?
Thanks, Michelle.
In a very broad statement, to that, without having the references on hand, there are a number of global studies which will show you, and they're from economic studies from organisations like the World Bank and the Asian Development Bank, that will show you that if you invest $1 in preparedness right now, you'll probably save 7 to 10 into the future in recovery costs and rebuilding costs and response costs. So the cost benefit analysis is very simple, very obvious. The data is already there that backs it up, and it should be, and we should be just investing a lot more in preparedness right now.
And if I could chime in briefly there, the Australian government budget used to be, and it's changing slowly, but it used to be 97% on response and recovery around disasters and just 3% on prevention and preparedness. And we do know from John's, what the research that John was pointing to, that those Stitch in Time saves 9 initiatives that we can invest energy into now, and not only save a lot of economic costs downstream, but also all of the probably uncosted emotional traumas that, you really can't poke a stick at the amount of social costs that's ramping up.
Heidi. So I'm going to say to Suzanne, I think in the chat, as well as the Q&A, there are people reaching out. So I think in the chat, a few people have suggested contacts for you. So I'm going to skip Suzanne's question about, is there anyone on the Gold Coast who wants to partner with her? But I am going to go to Judith's question about the role of council. So Judith has a question that says, what happens next after you attend and conduct a forum with council? Is there a set process? I can only imagine the answer to this is all sorts of things happen depending, but Michelle and or others, do you want to say what happens next? What can Judith expect most?
I think one important thing is to, I'm really reflecting on that word, what can people expect? And I want to turn that word, what can people do locally, and what actions can you take from where you're standing in response to those forums? So the people online today, and I'm looking at you, Amy, was one of those people in the room at one of those forums who, Amy, if I can share, went on that evening to write and get a grant funded. So maybe I'll pass that to you, Amy, as an illustration of the actions that local people are taking in response to those forums. I can share more as well, but I think it might be nice to hear from you.
Yeah, no worries at all. So we've formed a partnership with our local council. So the role is disaster. I can't actually remember her exact title, but Kylie Wallace on Singleton Council, we've partnered with in our grant application, with also Raylene and a number of other stakeholders, one of them being Sketch It Live, which will interpret all of our information in many different formats to cover all disabilities. We have local council, we have CEDA as well. So we've got a number of stakeholders involved on the grant. Council more than happy to work with us. And that grant is to deliver a face-to-face series of the PSEP workshop delivery. So that came from Raylene's recommendation, who was finding online to be challenging and wanted access to, I guess, localized a place where she could learn locally and, more importantly, develop those local connections, because that's what she felt was really lacking. And that was where the challenge with the online groups, she still wasn't getting that form of connection that she needed. So I don't know if that answered the question, but our council is working with us very closely to deliver PSEP locally.
Anyone else would like to add to that? Do you want to say anything further, Michelle, or are you good? I think Michelle might be frozen, but we'll see. I would like to jump to Kath's question. Kath Smith, it's $1 million question, Kath. Thank you for asking it. I'll jump straight to the question, which says, how do we get everyone to have a plan? And then how do we get agencies to acknowledge individual plans at the community, the municipal and the regional levels, and then embed the knowledge in our relief and recovery to ensure that there are better person-centered outcomes rather than a one-size-fits-all? So the shortest version of that question is, how do we get organisations and people across the system to understand that everyone's not the same as everyone else. I think drips on stones eventually. We just keep going. We just keep going. We refuse to give up. We keep going. But I don't know if there's a wiser or cleverer answer than that from the panel.
I'm actually just wondering about Emma. I don't want to point, call on you, but I do want to call on you because I remember our initial conversation with Rocky Bay and DFES in WA, and your interests and concerns about people who communicate using different technologies and some of the challenges with the trialing 000 and how hard that was to access. I just wondered if it might be helpful for folks to hear kind of some of your starting points in connecting with emergency services around that challenge.
Sure. Yeah, we had a customer who lived with his father, and it was actually his father who had the heart attack, and he couldn't call 000 to get help for his father, and so that was really traumatic. He had a communication device, couldn't ring 000, couldn't TTY is the other way that they do it, couldn't access that. So I think it's also, even if you do think that customers or people with a disability are living somewhere with support, it could be the person who is providing the support that turns out to be needing the support. So, and it's really hard to think of all of those steps of things that you think until you're in that situation, and then you realise that there was a whole host of problems that you hadn't even thought about in that situation. So you kind of don't know what you don't know to start with, but I guess we can learn from other people's experiences in emergency situations and try and put a plan in place from that. Yeah.
And it's interesting that this question of how do we ensure that organisations across a system understand that not everybody's the same is actually a valid question in just about every sphere of life we can imagine: education, health, all sorts of things. So it's partly incumbent on all of us, particularly those of us who are in roles where we reach out to many, to just never give up reinforcing that we have to have a plan A and a plan B and then 3 options, and that everyone is not the same as everyone else. I'm extremely conscious that we could do this all day. I would like to ask, and I think I saw someone with their hand just now, is there anyone who'd like to just have, and we can have a couple of final words, just have a final kind of word, a contribution that is top of mind for you as part of the panel, and then I'll need to close.
It was me who threw my hand up, Margaret. Just on that topic in particular, I think the power of the DIEP forums is really important by bringing different stakeholders together to communicate across different sort of spheres of society, and keeping that kind of work going. I think all too often in the past, we've been quite protective over our spheres of influence, and I think we really need to break down those bubbles and talk between spheres. In particular, in disability work, there has been an upsurge in competition between providers, and competition is the opposite of what we need to be doing here. We need to be collaborating and working out how to work together. And that's not something you want to be doing in an emergency. You want to be doing that now while the phone is working and the weather's kind of okay. One example is 2 organisations that live locally were impacted by a storm, and they had trouble getting staff to service providers. So subsequently, they have mapped their staff and mapped their service providers and put in an agreement between those 2 organisations that the staff from a different organisation can support their other client in case of an emergency.
That is a lovely note to end today's seminar on, Heidi. Thank you. That's perfect. It is all we have time for today. So again, I would like to thank Michelle, Parvathy, Emma, John, Amy and Heidi. And I'd also like to thank Alyssa and Dana, who've been our lovely Auslan interpreters. Thank you all for sharing your knowledge and skills and being involved in today's seminar. On behalf of AIDA and the Collaborating for Inclusion research team, thank you to everyone who joined us for this webinar, the third in the series. An email will be sent to you all once we complete today's session. We'll put it on the recording live on the Knowledge Hub. Please keep an eye on updates from AIDA for additional webinars in this series, the one that will pull the puzzle pieces together, and also the one I referred to on Wednesday. When you exit today's Zoom session, you'll be asked to complete a short survey. Please complete it for us. We do use that information to guide our events program to make sure it meets your needs. So please take some time to share your thoughts with us. It has been a pleasure to host you all this afternoon. So thank you for attending and participating. And until next time, stay safe. Farewell.